Hi there and welcome to the Longevity and Hormone Health Podcast. My name is Sandra Spencer and I am a midlife coach and holistic healer. And I'm joined by my good friend, Dr. Fareeha.
Hi, I'm Dr. Fareeha Rizvi. I'm a consultant in diabetes, endocrinology and obesity, and I co-host the Longevity and Hormone Health Podcast with Sandra. Today, we are discussing menopause. We are going to discuss the specifics of menopause, how you can start to feel better immediately, tips, tricks, diet, exercise, supplements, everything you need to know about menopause, we are going to discuss today. We are going to discuss menopause and midlife, everything you need to know as a woman who may be perimenopausal or going through menopause, or if you know someone who's struggling with perimenopause or menopausal symptoms. You may even be a man and want to know more for your wife, your sister, your mother, anyone in your life who's a female who may be experiencing these symptoms. This will really be your handbook, your toolkit to deal with menopause. So I think, first of all, Sandra, we need to define what menopause is from a medical perspective. So this is something that I have to tell people in clinic all the time. And you and I have discussed before how surprised we are that women don't really understand their reproductive health very well at all.
No, I mean, like a lot of them, if they say menopause, well, even my own journey, when someone said, oh, get your hormones checked, and I was like, I think I was like 42 or something like that when I started with the perimenopause, and I was like, are you joking? I'm not like, I don't have one foot in the grave. Like, why would you talk to me about that? I had no idea. I didn't even know that perimenopause was a thing.
Yep. And that's something I see in clinic every day, because women in their 40s, they're usually done with having children, they're usually done with that phase of their life, and so they don't expect these hormone changes to be coming, and they can often come out of nowhere. So how we define menopause medically is actually quite strange. So we define menopause in a woman has gone through menopause when she has not had a period for a year. And that's very strange. I know you've done your certification in menopause. It's a stranger diagnosis in medicine where a woman actually has to be suffering for a long, long time before she actually gets the diagnosis. So if you think of a woman's lifespan, we're a child, a young girl, we go through puberty, then we have our reproductive years where we hopefully have a regular menstrual cycle. And our peak fertility is usually immediately after puberty in our 20s and early 30s. From our mid 30s, fertility tends to go down. So that's your ability to conceive goes down, but you may still be having regular periods. And then kind of around the age of 40, early 40s is where the perimenopause symptoms can start. And that is when, as you mentioned, 42, perimenopause symptoms can start for around 8 years before menopause actually happens. And in Afro-Caribbean women and South Asian women, symptoms can happen a lot earlier, actually.
And they can be a lot worse.
And they can be a lot worse, which we will discuss. So perimenopause is the time of declining fertility, but actually what is happening is, instead of the beautiful regular menstrual cycle where you ovulate and release an egg in the middle of your cycle, and you have this lovely up and down of estrogen and progesterone, this beautiful orchestra of hormones, that goes completely haywire.
It's like a tsunami.
Yes, it's like this. It's basically like this. It's like an earthquake, reader. So that is what is happening to your hormones in perimenopause. So women may be having periods, but the periods may be becoming irregular. And along with that hormone change, it's not just one hormone, it's multiple hormones that are changing, specifically estrogen, progesterone, and testosterone, and along with a lot of other hormones. So perimenopause can start for 8 years before the age of menopause. Menopause is when we stop having periods, and then after that we are postmenopausal. So these are really important phases in a woman's life.
And I think that also that, and I'm going to talk about, because I think this is really important for people at home, right? Because that's not just the rules and that's it. So for myself, for example, I had an induced menopause because I had very large fibroids, and so I had part of my uterus removed, which meant that I couldn't have that reproductive cycle. And so for me, that brought different challenges that you would think in the textbook wouldn't happen. Do you know what I mean? And I know other people as well, people who may be on different medications or who have had a cancer diagnosis and stuff like that. So I think, can you kind of like just, I don't know, explain and chat about that? Because I think that these are the things that don't always get talked about as well.
You're absolutely right. So, as you said, natural menopause, which we've explained.
Yeah.
The surgical menopause or medically induced menopause, that is a specific category of women. I see many, many women who have been going through breast cancer treatment, breast cancer survivors. Often, unfortunately, younger women tend to have more aggressive breast cancer, so they need more aggressive treatments, and they often go into menopause in their early 40s, even their late 30s.
Yeah.
So this is where your GP or your oncologist or your endocrinologist should really be counseling you as a woman that to expect these changes and to preempt them and to be having the discussions of treatment options. So cancer survivors can't have HRT, for example, but for a woman that like yourself who's going through some surgical procedures, HRT is a reasonable option after all the diet and lifestyle changes have been put in place. So these are real frank discussions that hopefully are happening more and more, but it sounds like that wasn't really happening when you
wasn't translated at all. And then let's talk about the sort of diet thing, because as my weight was increasing and I was going to see someone and they were just, I mean, there were things like, well, yeah, fibroids can get involved, and you know, that they can affect your weight. You can have a big belly with that. That was one. Almost like a, I hate to say it, but it felt like, I'm not saying it was intentional, but it felt like gaslighting. And then the second one with the weight gain. Oh, well, you know, well, you are borderline insulin resistant, but you know, that's normal at your age. And, you know, well, you know, maybe just eat less, or maybe just, there was no kind of structure around this happens and this hormone does that and this happens and this does that. So I think what I would like to demonstrate through our podcast is these things, these little things that get dropped in between the cracks. So could you kind of, I don't know, explain a bit more about that?
You're so right. So I had a woman literally yesterday in my clinic who has seen, I'm not kidding, in 2026, so we're currently in July, in 2026, she has seen 20 different doctors.
That's insane.
For her perimenopausal symptoms. So this kind of speaks to exactly what you're saying. All of these various symptoms. She's had weight gain, she's had sleep disturbances, she's had palpitations, she's had fatigue, she's had joint pain, she's had hair loss. She has seen a cardiologist, she's seen a dermatologist, she's seen a GP, she's seen a rheumatologist. She's seen me. So she has had multiple wasted appointments. And, you know, the basic things haven't been done. She's just been told, you know, you're a bit anxious. She's been offered antidepressants. She's been offered sleeping aids. She's been offered the GLP-1 injections. The basics haven't been done. And when I saw her yesterday, she broke down in tears and I spent 45 minutes with her. And, you know, hopefully I was able to kind of absolve her of all of this back and forth a little bit and feeling like it's her responsibility. And any one of those doctors could have helped her a bit more. But I also think women need to advocate for themselves. And now the narrative is changing. You know, don't just believe what your doctor's saying. Obviously, you know, don't go against medical advice where it's life-threatening. But she needed, I think, to advocate for herself a little bit more. And I hope that we can change that narrative with this podcast and just through general discussions as women, that there's no need to be aggressive or difficult or, you know, going against what doctors are saying, but you just need to open that conversation yourself.
But I think that, so I'm going to go on some personal experience and what people tell me as well. And there are some key things here. Like, so with hormone health, especially in women, the medical, you know, the clinical diagnosis and all of that is super important, but the emotional support as well is super important. And what I hear and what I've experienced myself is that there tends to be almost, if it's not dismissive, if it's not in the textbook, if they haven't experienced it themselves, you do start to sit and wonder oh, am I imagining this? Am I being difficult? Is it just because I'm stressed? Am I burnt out? All of these things. And you just sometimes need like that support system, some hand holding that says, you know what, let's take it one step at a time. Because I guess if I was to give it like some kind of like, thought out there, when your hormones are out of sync, it's a little bit like putting diesel in a petrol car, right? You put the diesel in, and then all of a sudden the spark plugs don't work, and the gear stick doesn't work, and this doesn't work. And people have no idea just how many symptoms in the body it affects. And then if you're not being supported as well, this is why some people just get really, really, really anxious and stressed, about menopause.
Just to go back to your point before, and menopause symptoms, 80% of women in perimenopause experience hot flushes. Up to 70% have disturbed sleep. 80% have weight gain, which is what you were discussing. 90% have mood changes. So that is what you mentioned, anxiety, low mood, kind of just loss in interest of, your usual habits, hobbies. And then other things, joint aches, hair fall, just like my patient was having, palpitations. She saw a cardiologist, like I mentioned.
Itchy ears.
Itchy skin, skin. She went to a dermatologist for that. And then the thing, just circling back to what you were saying before, and you've said this to me many times before, is loss of identity.
Yes. Oh, yeah. I mean, I think that was the major catalyst for me to get help. Unless you're going through it, it's really difficult to explain.
Yes, it is.
But you can eat the same food. You can go, you have the same job, you have the same wardrobe, you put the same makeup on. But I kid you not, I remember the day, right? This is many years ago, that I looked in the mirror and I couldn't recognize myself. And I was asked, and I was like, I was actually looking and I was making faces. And when you try and smile and try and give a pretty smile, and I couldn't get it. I couldn't get it whatsoever. And then, all of a sudden, because of these things, and when when I started, going through perimenopause at work, and I started to stammer. Never done that. So then when you hear that you're about to stutter and stammer, then it gets worse. And so this whole thing that you're carrying all day, it just goes. So we've obviously talked a lot about this, but do people need to have a blood test or anything to get diagnosed?
So I know you're a menopause coach yourself, so you have your own approach and opinions with regards to this. But in my clinic, what I do, and this is part of the guidelines that we've developed in our hospital based on international guidelines, that generally perimenopause, for example, is a clinical diagnosis. So it's a diagnosis that a doctor can make generally without blood tests if a woman is over the age of 45 and she is having irregular periods and she has typical symptoms of perimenopause. So those three things are important. So a doctor can basically tell you, yes, if you're over 45, you're maybe having hot flushes, disturbed sleep, weight gain, skin changes, mood changes, and you have irregular periods, then you are in perimenopause. So the guidelines have changed a little bit, because I think this actually helps women, that you don't necessarily need a blood test, but I know you're a bit skeptical about that.
Well, yeah, because I was like 40. Let's say I was 41.
Yes.
When I was having the symptoms, but I know people who are younger, and also when we're talking about ethnic minorities, some ethnic minorities do start earlier than others.
So then, for women under the age of 45, there is guidance on doing a particular hormone test, which is the FSH hormone level.
The
follicle stimulating hormone, FSH. And there are guidelines around that if you have two values that are a bit higher than normal, then we can consider you to be in perimenopause or menopause. The problem with blood tests is because, as we said at the beginning, the hormone levels are literally like
Exactly.
this.
To get you on a good day or a bad day, right?
Exactly. Good
Yeah.
day, good week, bad week. The
Yeah.
blood test can vary so much that actually sometimes the specific hormone blood tests don't help. They actually don't help, and they can actually like have the opposite effect. Like if you have a normal blood test, and then the doctor might say, no, you're not in perimenopause or menopause. So we have to tread very carefully, specifically around the estrogen, progesterone, FSH, and LH blood tests. But I do loads of other tests for my women. So other things like thyroid health, vitamin D, iron levels, B vitamins. These things are really important, particularly if a woman has fatigue, joint aches, hair fall, that sort of thing. So blood tests are a bit of a complex area. And I would never say no to blood tests, just to make that clear.
I think, yeah, I mean, for me, with the stuff that I do and in terms of the coaching, generally I kind of need a diagnosis per se. I wouldn't, because I wouldn't want to start someone doing X, Y, and Z without it. There are questionnaires, of course, like in terms of the symptoms. So are you suffering with hot flashes? Are you restless at night? You know, have you found that I don't know, snacking late at night, fatigue, all of this, brain fog? Do you feel like you have those symptoms? And then we can kind of, put that together and go, 7 out of 10 of these symptoms do relate to perimenopause or menopause if they're older and they haven't had a period. So, yeah, I get it. And I guess this is where we do need that. We do need to, you do need joint forces when working with women like this, because you've got, as you said, you've had this lady, this client who's come in,
24
seen
hours ago.
all these different people, and no one's actually gone, right,
I mean,
okay,
I'm
before
laughing,
you,
but
and then just put like,
she was crying.
no, it's because it's traumatic. And you know what? You think you're going crazy.
Yes.
You think you're going crazy.
She felt like that.
And what I've seen and what I've learned with the coaching and the focus groups that I work with is, as soon as people kind of have some kind of, you could be perimenopausal, or if you haven't had the period yet, it's more likely to be menopause. They can kind of go, okay, they can take a breath and take the pressure off themselves, and then kind of go, okay, what do I need to do?
And they feel validated.
Yes.
That's the most important thing as women.
Yeah.
Women often just never feel validated in their life.
In anything to do with their health, especially. Even when you talk about, sort of, if we talk about the whole cycle from, from periods and then into childbirth and then and then pregnancy and then post-pregnancy, and then, and then your hormones are all going again. Like, and what I found is we just seem to just, keep it into ourselves and, like destroy ourselves, when actually we could just go, you know what? Yeah, I've got that. So what do I need to do? That's it. What do I need to do? And you can tell a woman who has taken control.
Yes. And destigmatizing it. The region that you and I are in is actually quite complex to navigate. There's so many different cultural beliefs.
Oh, in the age of despair. I'm in the age of despair. I mean,
the Arabic translation for menopause, which you taught me, is extraordinary. I haven't heard anything like that really in any other culture.
Yeah.
And so we have to be careful about, helping women find their voice.
Yeah.
And gently coaching them along to be able to speak up and speak out, because historically, my women in my own family, if I were to even ask them about menopause, and I'm a doctor, they would all just say to me, "Oh no, I was fine, nothing happened."
Yeah, of course.
So that narrative, hopefully, is dissipating.
Yes.
Over the last 5 or 10 years, so many women in the media, so many doctors, coaches, so many people have done so much work. Hopefully that is trickling through to different cultures and different, regions and different beliefs.
Well, could I just give you an example that they are willing. So I went to an event, nothing to do with midlife, but someone asked me what I did, and I said, well, I'm a midlife coach and I do holistic healing and so forth. And these were Emirati men. And they said, oh, right. And then when I tried to explain to them about the longevity advantage, and I said that I coach women and men, And they were like, oh, why do you coach men? And I said, well, because, and when I explained to them about what's happening to a woman and the benefits of you knowing as a man, they were really, really intrigued. And they didn't, I thought that they might just be thinking, oh, yeah, shut up. They actually thought about things, and they were like, and they then opened up and said, oh, yeah, I think my wife is because she does X and she does this. So I think it is. But I think that we should also include men.
Yes, we should.
Because they are the ones that could actually create that support system at home or in the workplace. And actually young men, so I'm the mother of it's a big strong cold man, but young men, them knowing, because they will experience as well partners or their partners' mothers, anybody who has education who can say, oh, have they thought about this? Do you think that they might be this? There comes a natural empathy with that. So I think it's important for everyone to know.
It's absolutely crucial, actually. I think women have been quiet for too long, to our own detriment.
Yes.
And I have a daughter, and I don't want her to, feel as if women's health or women's hormone health is something to be ashamed of, or, okay, we don't need to talk about it all the time to everyone. We have to pick and choose our conversations, but it's never something that we should shy away from.
I think. And I think on that, you touched on something that actually is really close to my heart, is that I feel that every woman, regardless of how much they earn or where their nationality is from or anything like that, should have access to knowledge and to hormone therapy treatment, hormone replacement therapy, if they need it. I've seen some people suffer so badly, and I tried to talk to them and just haven't been able to access it. And I just feel that we have a responsibility to be able to educate everybody, regardless of who and where they are, about what they can do to enhance their life through this transition. And I call it a transition because realistically, the sooner that you know about it and the sooner you get a handle on it, the better that you can start living life. Literally, after my diagnosis and after my little creams, as I've told you about, I was going in hot air balloons, I was doing zip wires, doing so much. And I used to feel quite embarrassed to talk to someone about it. I don't have no problem discussing it anymore.
Well, we've covered so much in the first introductory episode about menopause. What take-home messages have you got, Sandra, for any of our listeners?
I think that you used a good word, which is advocate for yourself. I really do think you should advocate for yourself. I think you should, find that voice, find that confidence, and you should, find your tribe. Talk to your community, talk to your family, talk to your partner if you're in a relationship and you're having certain symptoms, because your partner probably doesn't know what you're going through,
I agree. I think social support, if you can find a support system, reach out to existing friends, older friends, younger friends, meet for a coffee, have a discussion. There's absolutely no harm. And most people, the majority of people, will be so much more empathetic than often we give them credit for even. So that is, I think, really key, to start having the conversations with your friends, with your doctor, with people in your family, women in your family, men in your family, so that we can ease the burden that we're all carrying in midlife.
Yeah. And I want to say as well, if anyone has enjoyed this podcast today, is to just give us feedback on anything that we may have not covered, because we can always cover it in the next one. And also whether or not you would like to meet us and have these discussions in the community, because I think what we're looking to do really is we're looking to have these conversations, small intimate conversations with groups of women who can literally come and sit and ask us questions, talk to each other, and have that support system there if they may not have it at home. There's a lot of people in this region who actually are here alone.
Yes.
And
Yes.
maybe they work in very young environments. I was one of those people at that time. But, we're looking to create this community for everyone where they can just come and have a coffee and just really learn about their hormone health.
Absolutely. We'll keep you updated. We'll put more details in the caption. We'll put links to Sandra's website and landing page and all of the great stuff that she's doing. I'll put links to my social media, and maybe we can summarize all of this into a nice document for people to download, keep, read later. So all of those things will be in the caption below, and stay tuned for the next episode.